So we're going to go up to Westchester, New York, and I'm going to start we're going into afternoon session here. So boom, lights are on. So the background's going to slowly change throughout the day. Hari, welcome to HCM.
Lisa,
Day.
how are you?
I'm still pumped and full of caffeine, and we're halfway through the day almost.
Yeah, it looks like a marathon day for you, Lisa.
It's like HCM Telethon and State of the Union all in one.
I know, but this is great. I mean, I don't know how many years we've done HCM Awareness Day, but this is kind of the big one, I think.
It's the first technical one?
I think so. There was a little bit last year, but I think this year, we're seeing a lot more efforts. So I think that's great. I'm putting some stuff on Twitter. You're doing this. I think the time has come because people, a few years ago, they'd be like, what's HCM? 10 years ago. Now, at least people know about it. And there's a whole day. So they know that there's something going on here.
Something's definitely going on here. So what's going on up in New York?
All right. I'm going to show some slides. That's cool.
Go right ahead.
All right. So let's come up here. All right. You can see this?
3, 2. Yes, I got it.
Okay, great. So, I'm going to give you some updates about the WMC program. You know all these things for our audience, and I'm going to highlight some people and certainly our team and obviously the HCMA as well. I'm going to go a little history because I think I heard Dr. Wang talking about how they've been involved for 20 years. I mean, I think the beauty is that people have been involved in this field now for a long time. And I think last time we talked, you called me, I think, second generation, first generation being the folks in the 70s and 80s. And then a couple of people like us came along. And then there's been a third generation, maybe even a fourth generation now. So it was interesting to put this together because you're right. We've been doing this for 20 years. So in 2002, I did my first alcohol ablation when I was a fellow at Penn. Then my first on my own was at Cornell in 2004. You were with me when we launched the program at Winthrop in 2006. I was on the guidelines at that time until 2011. That's what really sparked more my interest in being really part of this community and really being, helping the community grow. That came out in 2011. And together we launched the alcohol ablation course, as I'll show you, in 2014. We've done 5 of them since then. Then we published this textbook that you were a part of. You see that on the right. And the first edition came out in 2014 with about 30 authors. We moved the center to Westchester, where I am now for the past 6 years now, believe it or not. The second edition came out in 2018 and had something like 50 to 70 authors, 60 to 70 authors and 30 something chapters. I think you did 2 of those chapters, Lisa. So thank you. Myself and Dr. Panzer came out with this cardiology clinics book. I'm not sure you saw that, but that was good. It's also smaller and much easier to digest. The textbook is 500 pages, a lot different. And then over the past few years, we've been involved here in the clinical trials, as you know. Help present the Explorer late-breaking clinical trial for the symptom relief or symptom aspects of that. We're part of Valor that will be presented next month in the New England Journal, hopefully, and the late-breaking clinical trial at ACC. There's a new board of HCM that's starting. It should be launching soon. And we're now involved in the trial of aficamten as well. That should be launching any day now at our institution to give options to patients.
There might be some news coming later today on that topic.
Oh, that's great.
You want to stay tuned.
Okay, awesome. And then, I just talked to Springer about starting the 3rd edition of the textbook. It'll probably be the same number of chapters, just updates. I'll probably mix up the authors a little bit more this time. There's been a lot of new players in the field. I'll probably talk to you, Lisa, about who to get more involved. Because, with anything else, some people are less involved in the field and people are now up and coming in the field. And the textbook is educational, but it's also an opportunity to give people, some segue into the field and to really stake a claim to the field. So I'm eager to do that. A lot of new names that really weren't even involved as much 5 years ago. So at our program, I think, what we've tried to do is put together a program that has, quote unquote, everything under one roof, including a large catchment area of patients that can really just come see us within an hour, essentially. So, I put together these 16 things that an HCM program should have. It's a lot of stuff, but I think that we have all 16, and I spent a lot of time trying to make sure that each of these areas become autonomous, meaning that I'm the quarterback, but we have good people in all these areas that I can really trust. In other words, if I need a pacemaker done, I send them to our HCM EP physicians. They know how to put a pacemaker in an HCM patient. They know the complications. They know the lifespan of these devices in them. They know the worries, and they know how to program them efficiently without inappropriate shocks and this and that. So it's very important that each of these things are not just present at your institution, but really micromanaged so that they're really at the highest level. And I know you know this, but I think I'm just trying to show that really we spend a lot of time making sure that every area of this is really cutting edge and moving in the direction where outcomes are high, consistent with low complication rates for our patients. I highlighted the areas that most programs don't really have much. They either don't have a pediatric hospital that can do the EP in pediatrics or surgery in kids, alcohol ablation or myectomy. A lot of places have one or the other, but not both, at more than 10 to 20 per year. We have a heavy heart failure transplant program, doing about 30 to 40 transplants a year. So that helps our patients who get to that end stage, including ventricular assist devices, advanced stress testing, genetic counseling through dedicated counselors, and obviously the clinical consultation and follow-up. I put down some key tenets that I think are differentiators in our program. One being that we have two offices, one in Long Island and one in Westchester, and our whole staff goes to Westchester and goes to Long Island on different days so that our patients don't have to travel as much. And each of these offices can do pacemaker interrogations, echo, stress testing. We have 2 nurse practitioners, 2 coordinators, and now we have a fellow rotating on the HCM service. All of our 6 advanced fellows are now mandated to be part of the HCM rotation, which I think is wonderful. They see inpatients and outpatients, and they learn HCM care prior to graduating their fellowship here. We have I think number 2 is very key. We have a dedicated team that's knowledgeable on HCM that answers the call. So when patients call, they get only an HCM phone. They only get Mallory or Carolyn or Nicole. They get these 3 people no matter what, off hours, on hours, holidays or not. It only goes to them. It doesn't go to the regular answering service, which means that they know the 3 people who are going to answer the phone. Those people know about HCM. They can handle most things, and then they can titrate up to the NPs, clinical issues like if they admit to another hospital or whatnot, and then goes up to me if there's something that needs that level. This allows us, I think, uniquely to be both the primary and the specialist for our patients. Because we have such a large catchment area, our patients keep us in the loop on everything. And I think it's unique because some programs they have to fly out to, and then when they're not there, most of the stuff is happening with the primary cardiologist, and the specialist may not know what's going on. I really pride myself on knowing what's going on with our patients because we're just so easy to access and we're within driving distance of them. It's not to say we don't work with our primary cardiologist well, we do quite well, but I think they're also happy that we're so involved in the care of these patients. Another programmatic aspect of our center is that we have organized relationships with all the hospitals, meaning even hospitals that don't send to us routinely are not part of our network, like the North Shores or the St. Francis or the Stony Brooks or the LIJs or up here, White Plains and other places. I have people at all those hospitals who take care of my patients when they're there. So if a patient gets admitted, I know who to talk to go see my patient. And if there's something that needs to be escalated, they'll help organize a transfer to our hospital. So that I think is something that has evolved over time because otherwise you lose control of those patients and then they get poor care, as you know. We spend a lot of our time trying to handle patients at other hospitals who do all the mistakes that we try to avoid as centers of excellence. And then finally, since we do a high volume of myectomy and alcohol ablation, as well as advanced heart failure and bailout strategies for some of these patients who really get end-stage heart failure, and because of the clinical trials, I think those are areas that we're moving into in our program. These are the 3 areas that you've probably seen the slide, Lisa, that I think define a center of excellence. And I try to keep Westchester Medical Center overlapping all these things. You should have comprehensive multidisciplinary team, all diagnostic and treatment modes available under one roof, coordination of care and ease of access for the patient, then a large volume of patients in your catchment area in both pediatric and adult and all phenotypes. And finally, I think the national presence and the lectures and the education are very important because, as you just heard from the other speaker, moving forward is very important and making sure that you're always at the cutting edge and really trying to spread the word about HCM like we're doing today. And the strengths of our program, again, are the 2 locations, the 2 coordinators, 2 NPs. We do the most number of alcohol ablations in the country right now. Myectomy is about 20 to 25 a year, depending. COVID has been tough in that regard. Advanced heart failure, genetics, pediatrics, the training courses, I'll show you the guidelines and the national presence. I published this a few years ago. This is outlining all the different hospitals that do alcohol ablation. We were the highest at that time. followed by all these other hospitals. Probably need to update this as well. We did this training course starting in 2014. We did 5 of them, and then COVID, we bailed on 2020 and 2021 because of COVID. So I'm gonna have to figure out with you, Lisa, and others, what we do with this. In the meantime, I've gone around and helped proctor places, as you know, and talked to you about which places really warrant that level of teaching and expertise. These are the 2 textbooks. I will say in the past couple of years, and I don't know if you saw this when you were here, Lisa, I think this is new, the new ambulatory pavilion. This whole glass building here is our you did see it? Is our outpatient facility. And it's really been amazing, honestly. I didn't realize how much of a benefit it is to our patients and also our sense of well-being and practicing. Our office is beautiful, huge rooms, all the capabilities, and then 1 flight up is the cath labs as well as the recovery areas for patients. So one thing nice, especially during COVID, is patients will be able to come in through a separate entrance with different protocols, keeps them safer from the main hospital. They all have individual rooms and easy to social distance, and has been able to have a very seamless patient care for these patients to come into the ambulatory pavilion, get their procedures, be it TEE or echo or cath or stress testing or MRI, and then get out, relatively quickly and very efficiently in a very healthy environment. So that's been a real boon to us. I certainly underestimated how good and how important a new building is. I will highlight our team. First and foremost is Dr. Panza. You see on the top left here, he's my chief of cardiology. But part of the reason I came here, as you know, is because he's had if I've had a 20-year history in HCM, he's had a 40-year history in HCM. He worked with Dr. Marin and others at the NIH, and he has a lifelong commitment to this disease. And he also sees patients with me. So he sees some of the patients with HCM, and I see the majority of the patients with HCM, but we have similar styles in terms of how we take care of our patients and prioritize them. I think Lindsay Davis here. She was here for a day.
She'll be on later today.
That's great. And so this is our offices, and so she spent some time. This is our outpatient office. I don't know who this person is.
She had prednisone. You shouldn't be showing that picture anyway.
Okay, I can compress it later for you.
What's that? That was May?
That was 2016, 17.
Oh, it'd be like May of 2017. I'm
right after your
prednisone
right after your transplant. So this is this is the team on Long Island for the opening, and I'll highlight the way I do these things. I have patients here. These are some of our patients, some of our staff. This is my dad. This is our echo lead tech. Obviously my chief, some of the electrophysiologists, non-invasive cardiologist, another patient. Nope, actually. And then Lisa, another patient's husband, actually. And then Lisa, there you are. And then this is the cath lab team. So, really it's a team sport. And I think one of the things I missed at my old hospital that I was able to get at Westchester here was have all these people together. I think our attitude is also, I think that our attitude is very friendly and happy. These are pictures that we've had at our office. They were for internal use. This is the first time I'm sparing them externally because this was actually during my birthday. We did all these cupcakes. And I don't know who we're taking the picture for, but I guess it turns out to be this. And then this is our lead echo tech and our IT and our cath lab and invasive operations director. And then again, I want to thank our patients. These are some of the patient stories we've had over the years, but it is true that we do learn from our patients. And I think one thing that we don't talk about that goes into the experience and the expertise is really seeing so many patients and starting to get some pattern recognition. And that takes about 10 years, but then eventually things just smell wrong or smell like something, and you kind of have a sixth sense about what's going on with the patient. And that I'm very grateful that we're at that stage here. Who's this person?
That's an old picture.
This is when we did the textbook or something. And yes, this is my Facebook name. But I like this picture because this characterizes our relationship. Me being crazy and you being like, what is this guy talking about?
I am rolling my eyes there. It does appear.
Exactly. This is a 20-year relationship. It's pretty obvious. I think we've worked well together, Lisa. I think on the textbook, and I think together, these are some of the programs that I visited and helped start their program. Some of them came on the calls today. I know Rochester was here, but I really, in retrospect, I'm really, some of the things that I really have enjoyed is feeling like I have had some say in developing programs. So I get a little sense of what you've been doing for the past 15, 20 years too. There's a lot of pride in that. And I think,
26.
Yeah, you've done a lot. I've done only these, like 6 or 7, but But it's been a lot of fun to do that. So I do want to end one last slide. I'm thanking everybody. The team is huge. It's actually grown since last you saw Lisa. So I have to update to you. We have 2 NPs. Dominica is a very experienced NP who's been in practice for more than 20 years. She has joined our practice and working more with Dr. Panza, but covers Carolyn. So I have to get her on the list. We have other people in imaging, EP. We've had Dr. Pan. I'm not sure he's on. I got to bring him up to speed with you. He's our specialist in amyloid and sarcoid. That's primarily what he does, and he's heart failure. But it's been really great because I was seeing a lot of the amyloid patients, and now when they come to me, I send them to him, and he does the biopsies. He does everything. So he's been amazing. You'll like him. And the rest, I think you see here, we are hiring a new pediatric cardiothoracic surgeon. We just hired them, so I'm going to contact you to get that person on the list. And that's kind of it. So I'm going to stop sharing and we can chat for a bit or whatever.
We got a couple minutes. We're doing like fast. This is like speed dating HCM style.
I know you are.
So it's State of the Union. It's rah-rah day. It's everything. So I do have to laugh. So you go back and you say, okay, first memories of working with somebody or getting to know them.
Oh, let's hear it.
ACC. The booth was back in a corner because I didn't get good spots back then. And this young guy comes up to the booth. I'm going to do HCM. You're going to do HCM, are you? Okay, what are we going to do to it? And I got all these great ideas like shot out of a cannon. And I'm like, whoa, slow your roll. And I'm like, we talked a little bit. And then I had to go off to a session. I'm like, okay, I have to go now. And I leave and he's still there. And he walked with me the whole way. And he talked the whole way. I'm like, this guy might actually talk more than me. I'm not sure.
I'm from New York. You're from Jersey.
So there is a little bit of a East Coast theme here today. And I forgot to mention this to Sarah Sabari when she was on earlier, because she was saying how much she liked working with Charlene Day. I'm like, Jersey girl, Matt Martinez, Long Island, New York, New Jersey. Maybe you need a little bit of that attitude to survive in the early days.
That's the energy,
yeah. So it's been great evolving and moving forward. We have some other things I'm not quite ready to announce yet that we're going to be working on, but by next HCM Awareness Day, I suspect that we'll have some other stuff to talk about, but we'll talk about that offline. So when I say like there's a lot of things happening in the HCM world, people, it's busy. There's a lot going on and it's all good. It's all
No, it's great. I mean, we never had this many different approaches, like different people interested in the field. But it is good because we struggled for so long with nobody interested other than us and our patients. And you started that. And so it's actually a breath of fresh air because we're not in this alone as much, which is good.
We are so not alone. We have so many wonderful partners, other organizations, industry, centers, just medical systems. All are understanding why not be smarter consumers of healthcare? Why not let experts guide the care? Why not take the lead from the experts who have already figured out the science? Let's be smarter. And we're doing this together. So that's pretty amazing. And it's really nice being a 26-year overnight success.
Yeah, right.
Where people are like, oh, well, we should do this, the other thing. I'm like, I've been here for 26 years. We tried that, didn't work. We're doing this now. Follow me, trust me. Right. And now we're building out more committees at the HCMA. We have more projects. We have more services that are very, very, what's the word I'm looking for? Perfected. I mean, it never gets to perfection, but we're perfecting systems. And it's not just Lisa on the other end of the phone with an assistant. We have a team of 10 here now. Yeah. And then we have all of our volunteers and committees.
I think that's been huge, Lisa. Over the years, it's been so nice to be able to tell a patient that they can call your offices because it's a third party, somebody who cares about the patient and can put things in context, and who it really helps them a lot. And so that's been really helpful for patients if they have questions.